Our Healthy Friday conversation is what we're going to do today. And we do all of this. We go across board and we'll talk about everything that needs to be spoken about that will lead us onto action, or at least will give us the knowledge that we need to then move into different spaces in our world. And that's why we do what we do. Necessary for us to do every day. A Healthy Friday conversation is something that you're battling with now. If you're not battling with it now, it's something that somebody you know or work with or live with is battling with right now, or that in the last 3 days somebody had or didn't have, right? We are fighting and preventing superbugs, and we're not talking about the ones that you spray with the bug spray. We're talking about the ones that somehow find its way into your nose, your throat, and those other things. Dr. Loice Ombajo is here with us this morning. She's an infectious disease specialist. Almost sounds like someone is insulting you. Good morning, Dr.
Good morning. How are you?
Very well, thank you. Now we are. A couple of days ago, things were being sneezed. We couldn't talk, and we were just not operating at optimal. And that's forming the basis for our conversation today, because there's something going around, and we would like to look into that today. But before we do that, we would like to welcome you to this program today with today's proverb. We go to a different African country every week. We come back with their proverbs. This week finds us in Guinea. And Guinea is in French West Africa, and very interesting that although no longer colonized, still heavily colonized, but still trying to break away. And there's some of the things that they had to say that we've brought back this week, and I'd love to get your interpretation of the same as we go into it. So this week's Proverbs, as interesting as they have been, and it's interesting that our Proverbs always somehow, in our African Proverbs, we look and we deal with animals every now and then. This one is not too different, but here's what it says. That it is God who drives away flies for the tailless animal. It is God who drives away flies for the tailless animal. What would you make of that?
Wow, this feels like a trick question. There's so many answers to it. I'm imagining a tailless animal must be fairly helpless. Can imagine if you watch animals and there are flies around the ears and around the nose, and it's fairly powerless to control that or to do anything about it. And I think it's about probably how to protect the most vulnerable in society, just as God would help, the tailless animals. That would be my take of it. In terms of, for me as a healthcare worker, many of the people who come to see me are very vulnerable at that point. How do we take away what ails them the most at that point?
Okay.
I'm sure there could be 100 different interpretations to that.
The beautiful thing about an opinion is that it's yours and that it can never be wrong.
Own it fully.
Absolutely. And we can all learn from it. That's true. Okay. So the last couple of days have had people wearing masks, sneezing all over the place, losing their voices, not being able to speak, having this general feeling of malaise. And somebody says very quickly, there's a bug going around. And then we start to ask ourselves different questions. And the first thing that somebody says, oh, you need to go get an antibiotic. Okay. You're an infectious diseases specialist. Some of these infectious diseases that we are talking about, do they form superbugs? Now we're trying to get all of these buzzwords sorted out in our heads. What does it all mean? And how does that then operate in this ecosystem that we are in today?
So maybe we'll start by just a brief description of what sort of things cause infections, and then go into what we'd consider a superbug in our present context. So if you think of many of the infections that people get, so like what you're describing, what you'd say an upper respiratory tract being the nose, the throat, the ears, and the upper airways. So an upper respiratory tract infection is often caused by viruses, and there are many different types of viruses. I think the one that people remember the most is COVID, because it was such a scary time. But there are other viruses that can cause those infections. All have fancy names. Some we call adenoviruses, flu, influenza virus. So there are viruses that can cause that type of infection. But there are certain other organisms that cause infection. Viruses being one category, but we also have bacteria. We have fungi. fungus, like what causes skin infections, like ringworms and, infections in the scalp and the rest. We also have parasites, or what some we call protozoa, like things that cause malaria, for example, cause amoebiasis, for example. So there are many different types of organisms that can cause infections. What we've been calling, or what in our current context sort of we call a superbug, is a bug that's hard to contain. So a bug being either the virus or the bacteria or the fungus, any of those things that we've talked about that could cause infection. So a superbug is one that we can't treat. And one of the problems we have right now is bacteria that have become resistant to antibiotics. So all these bugs that we're talking about, if we want to treat a virus, we use an antiviral against the virus.
Okay.
If we want to treat a bacterial infection would be things like a pneumonia, a urine infection, a bloodstream infection where you have bacteria in the blood and the like. We use antibiotics. If we want to treat a fungus, we use antifungal. But if you have resistance developing, so that you use an antibiotic but you can't kill the bacteria, then that becomes a superbug. Okay. It's a bug that we can't really treat well.
Okay. How do you create resistance? Because, before you'd pop an antibiotic, do it for the 5 days, 7 days, 10 days, for whatever, and you would be fine. But what we're saying here is that there is an infection that cannot be treated by an antibiotic because there's resistance, but that must have been created somehow. How does that happen?
So unfortunately, we create it ourselves. It's not one of those that someone created in a lab and released to us. So all organisms fight for survival, and they fight against threats. Okay. So if you're going to give an antibiotic, then the bacteria are threatened and they will try to survive that. So if you keep exposing bacteria to antibiotics, they change their characteristics so that they're able to withstand the antibiotic, so that their species continues. I think every species is interested in being around till the end of time, whenever that will be. So they change their characteristics and become resistant so that they can continue to survive. So the unfortunate bit, as I said, is that we create this. When we use a lot of antibiotics, bacteria become resistant because they're changing in order to survive. And the way this happens is, for the human body, we have a lot of bacteria on us, on our skin, in our gut, in our mouth and in our throat. There's a lot of bacteria, and a lot of it is surviving there harmlessly. It's not really causing us harm. If anything, it may be helping our gut. But when we keep dumping antibiotics into us, then this very bacteria that is within us becomes resistant. It changes in order to survive. Okay. So what causes infection then, and what spreads around, is now what has become resistant. So when you use the usual antibiotics that we're used to using, they no longer work.
So then that, for me, makes, because we don't hear of infections, one wonders how they spread, the transmission and all. But most importantly, because what you are describing is the treatment protocols that we employ are not accurate most of the times. Hence the resistance comes up, because I believe if we use the right treatment protocol, you would contain the virus or the bacteria or the fungus. So I'm just wondering, the challenge for most of us as normal humans who are not necessarily daktari like you is the detection or the proper diagnosis of what is it that I am suffering with now. So how would you say, when would one know? Because most of the times we hear people going and doing the over-the-counter medication. I'm feeling I have a headache, I think I have a viral infection, or and then the person just gives you whatever it is both of you may have agreed on. So how would you suggest in terms of managing the detection, the detectability? Because the lack of detection is the one that leads now to outbreak. And then the superbugs, the effect they have, like the COVID had. Where are we in terms of understanding or detecting and profiling them for proper diagnosis?
So I think it's sort of multi-pronged.
Right.
It starts from, for you as an individual, when should you be concerned enough to go to a hospital? So most of the things that we struggle with is usually the common cold, maybe a sore throat, a cough. Most of those are caused by viruses. Okay. And most of those don't even have treatment. They're what we call in medicine self-limiting, They live their time, then they'll go away. You'll be sick for a couple of days or for a week and it will go away. Many of those will require basic sort of home remedies, some honey, some lemon and ginger to make your throat feel a little better. And it's only rarely if someone has a fever or has, very severe symptoms that you may need to go to hospital. And in that setting, even in the hospital, you have to consider, is this a viral infection? Which means you need some Panadol for your fever, something to make you feel a little better. Or could this be a bacterial infection? In which case, that is the time you'll require an antibiotic. I think the danger and what we see often is everybody with something small, they rush and buy an antibiotic over the counter. But often that antibiotic doesn't make a difference in the progression of the disease.
So how come you feel a little bit better when you do?
You probably were going to feel better anyway, because it's just a matter of time.
Okay.
You probably were going to feel better anyway,
Right.
but because you've taken something, you think it's the one that's making you feel better.
Okay.
So I think the main thing we tell people is avoid that buying for yourself an antibiotic, because as we said, bacteria live within you, and if you keep popping antibiotics, what you end up with is this profile of bacteria that are resistant residing within you. And those are the ones that can cause infection in you later. So, for example, a very common infection is urinary tract infections in women particularly. So a lot of what causes these urinary tract infections is bacteria within the gut. So if you've been popping a lot of antibiotics, the bacteria in your gut, you'll have some resistant bacteria in your gut. And if then that person gets a urinary tract infection, it will be the resistant bacteria causing this urinary tract infection.
I see.
Then we'll be struggling to treat a simple urinary tract infections. And some of those get complicated, and you get complicated infection, and people die because of resistant bacterial that are resistant causing infections.
You've mentioned gut a number of times. So if we improve our gut health, does that have a correlation on our ability or the resistance against these bacteria and viruses to a larger extent?
So I think one of the best ways of taking care of your gut health is not taking antibiotics when you don't need them, because the bacteria in your gut is actually good for you. So you don't want to kill off the good bacteria and end up with resistant bacteria. So that's one of the best ways. I know people do a lot of other things. They say, I'm detoxifying and all those. I'm not sure that does anything for you. The best things to make sure you're healthy is, eat healthy, exercise, get enough rest, avoid too much stress. Those are universal standards for keeping yourself healthy. And then avoid taking anything you shouldn't be taking. And that includes antibiotics.
Okay. So why is it that with the viral infection, the ones that you've mentioned, the flu, the COVID that we see, do you pass on the same to somebody else? Like, how we normally say, well, the kids went back to school and then they came back home with the sniffles, and then you as an older person or as an adult or the parent, you get it. But it seems to be much worse in you as an older person that, they're going to run off, drink some orange juice and run all over the place and they'll be okay. But somebody who's older is completely waylaid by this thing.
Yeah.
Why is that?
So one, yes, infection spread. Things like the cold, the flu will spread in droplets, will spread because we are touching, kids are touching their noses, touching everything, and you're touching the same and really just passing on the same viruses to you. And many things, kids tend to fight things off a little easier. Their immunity may be a little better. Adults, especially older adults, may be struggling with other things, they have high blood pressure, they have diabetes, they have what we call comorbidities, other conditions that may have an impact on their body's ability to fight off infection easily. So as someone gets older, the ability to fight off infection is not as good as when they're younger. The other thing is that children are exposed to a lot of other things, so they develop immunity to some of these things. We vaccinate children against many infections as well, because when they're very young and they've not been exposed to certain things, they're at risk of getting them. So vaccination for kids is important. And for adults as well, for example, where there are flu outbreaks, you want adults to be vaccinated. We want older adults, above the age of 60, people who are diabetic or who have conditions that suppress their immunity, to also get vaccinations, because we know they can fight off infections easily. So vaccinations help them build immunity against some of these common infections.
So in that, I don't know what it's called, in that train connection, so you can find that everybody in the household or something got sick, would you say that was the same cold?
Usually.
And how does it die off? Because everybody gets better, or does it still just find its way to keep operating? How does that particular infection die off? And does that particular virus die off, or does it go out the window and find another
someone else to fight on?
Yeah.
So usually your own immunity helps to fight off infections, so kills the virus that's causing your infection. Of course, some you may pass on to the unfortunate person next to you, but your immunity is what fights off many of these infections. That's why we call them self-limiting. Your body will fight it off itself, and you get better. So that virus, the common viruses that cause the common cold, you can fight it off and go. But that's not for all viruses. There are viruses that our own immunity can't eliminate. So we have things like HIV, for example. It's a virus, but your own immunity can't eliminate just because of the way it infects all the cells in the body.
Yeah.
Some of this just if infect the cells lining, your throat and nose, and it's easier to fight those off.
Well, I don't know whether it's a myth, but the joy of having a doctor in the house is that you get to demystify some of these things. They say that you cannot contract the same flu or cold, the same strain of the virus twice. Is that correct?
Not necessarily. For some, maybe, because you develop sufficient immunity to be able to fight off the same strain. But the one thing we know, and we learned this during COVID, remember we kept talking about, what were those? Omicron. Do you remember this terminology that kept coming on? So sometimes the viruses also evolve because they multiply very rapidly, and in this process of multiplication, there are changes that happen within the what we call the gene of that virus. So those changes means with every iteration of this multiplication, it's a little different from what it was previously. So your body has not quite encountered this new strain, and that's why some infections can recur over time. And that's why, for example, in the context of COVID, they kept saying, the old vaccines don't seem to be working against the new strains because of those changes that occur within things like viruses.
And another one we need to demystify. You see, this is the beauty of having a doctor. Can you really and truly vaccinate against typhoid?
Against typhoid?
Yeah.
So I know recently there has been introduction of the typhoid vaccine in Kenya. I think one of the challenges we've had with typhoid is that there's been an overdiagnosis of typhoid. If you go to many towns and villages, everybody says nilitibiwa, typhoid, malaria, and something else. So one, there's been an overdiagnosis, and people have also diagnosed themselves. If they feel what they felt 10 years ago, they say, ile typhoid imerudi.
Ile typhoid ya tumbo.
Imerudi. So people have sort of overdiagnosed and use that as to also justify taking a lot of antibiotics. I felt better 10 years ago when I was given an antibiotic, so I'll take it again. But yes, you can vaccinate against some bacterial infections. Some of those vaccinations may need to be repeated over time just because the level of immunity they sort of induce in the body wanes or reduces over time. So those may need to be repeated after a few years. But yes, the vaccination against typhoid has been shown to work, and that's why I think government introduced this not too long ago. Yeah.
Okay. So obviously, when we're looking at viral infections, we're looking at those that then will essentially attack the immunity of someone. Is that what we're saying? Your immune system is attacked by this virus, and so then you're susceptible to these symptoms. Is that how it works?
So that's for some viruses.
Okay.
There are certain viruses that will destroy your immune cells.
Okay.
And the classic example is HIV. HIV targets the immune cells, so kills the immune cells, and that's why if someone is not on treatment, they keep getting other infections because their immunity goes so low.
All right.
Other viruses, of course, with every infection, your immunity goes down a bit because one, you've deployed, it's almost like if the country is attacked and we deploy all our military personnel to go fight one border, then the other borders remain a little vulnerable because everybody's focus is in one direction. So when someone is fighting off an infection, they could be vulnerable to others just because you've deployed your military to fight one thing and it leaves the rest of you a little vulnerable.
Okay.
But yes, there are certain viruses that characteristically attack your immune cells and leave you vulnerable to other infections, and I've given you an example of one.
So if that happens, you're going to forgive me here. This is rudimentary basic questioning. If that happens, where immunity is compromised, and we know that, nutritionists and people who are in the superfood business tell us how there are immunity fighting and boosting foods in our ecosystem. If you ingest those immunity boosting fighting foods, do you see that you are less likely to be infected by these infections if your nutrition is optimum?
So, as I mentioned earlier, there are certain basic things that if we did right, our immunity will be better. Okay. So, a balanced diet. I'm not sure there's an immunity super booster that you can take. Often it's just having a basic balanced diet, having enough sleep, making sure you exercise a bit, making sure you're handling stress and the things that bring you down a bit. Those are just basic things that make you generally healthier and able to fight off a lot of things that would come your way. Yeah.
Okay. So then,
so you don't have to spend money on a lot of immunity boosting things. Your body sort of knows how to take care of itself a lot of the time.
If it's fed right, it will take care of itself.
Yeah.
So now, on the other side, now you have this carrier. When someone is sick, now they are the virus or the bacteria carrier, right? Who is infected, basically speaking. And transmission is now what puts everybody at risk. That's why we had the social distancing. That's why it's all, like to wash your hands, sanitize, all those, depending on what you're dealing with, the superbug that you're dealing with. And yet, now going out to the public, either we are not fully aware or we are ignorant, because not everybody sneezes into their elbow or their shoulder or behind their t-shirt. A lot of people will go to a restaurant, they will spit in at the sink. You know? Some people will spit just walking along the road. And most of these are either airborne or they latch on surfaces where if you touch, then you get infected. So what do we do?
Yes, that's a good question, because we also have to protect ourselves. I think the main thing is protect yourself from infection so that you don't have to get treatment. So one individual responsibility is around washing your hands, because you can't control what other people do. You can only control what you do. So wash your hands after touching surfaces, before eating. Avoid touching your nose and mouth aimlessly, all the time with dirty hands, because that's how those droplets and things that are left around will get onto you. So basic hand hygiene should be like paying tax, you can't avoid it. It should be like VAT or something. You must wash hands. You must, as much as possible, maintain basic hygiene, clean surfaces. In offices like where you are, if people may come in, someone may not even know they're quite sick, they have a bit of a cough, but if you're cleaning those surfaces and people are washing hands, then you spread that infection a little less. So it's really taking responsibility for what we do. We can't control the people's spit. They can't spit wherever they go, but wash your hands and make sure you keep yourself safe. So that's in the community. For us who work in hospital, that's where the risk of spreading, particularly resistant bacteria, which is a very big concern for us. The risk of spreading resistant bacteria from one patient to another, lying in a hospital bed. And remember, we said when someone is sick, they're a little more vulnerable. The someone who's well and walking around, that risk is high. So again, the onus is really on hospitals to make sure those who are working in hospital wash hands, because we also spread this resistant bacteria from patient to patient on our hands in the equipment that we use. So it's about healthcare workers and all those working in hospitals cleaning hands, making sure equipment is clean, patient environments are clean. And of course, if you're sick, don't go to visit someone in hospital, because you're exposing them to what you may have.
It's an issue, isn't it? That the hospital is essentially one gigantic petri dish of infection. It's kind of almost ironic.
It is.
That the place where you go to find healing could be a place where you get sicker.
Yeah.
Interesting. Okay. There are a number of questions coming in. Of course, different kinds of infections. So we're not just dealing with the viral and across board here. But I'm interested in two things. Number one, what have we seen in society today, right now, currently, that are these super bugs that we're not able to treat for some reason? What have you come across? And then link vitamin C with this immunity thing that people eat a lot of oranges and lemons and grapefruits and whatever, anything that has vitamin C in it naturally, and it will help. Can you make the connection for us?
Okay. So in terms of what the concerning superbugs are for us now, one is resistant bacteria. Okay. So there are 3 types of bacteria that cause most infections that we see in those coming to hospital. And the concern we have now is that this bacteria probably 50% or more of this bacteria tend to be resistant to the most commonly used antibiotics. And that's a concern for us in hospital, because it means someone who's coming in or who has acquired an infection in hospital, whichever way, and has a drug-resistant bacteria, we have trouble treating you. So either we have to look for more expensive, more difficult to access antibiotics, but we've also had situations where there's nothing available. So you have an infection and you're sick and getting worse, and we have absolutely nothing to offer. That's a very scary position to be in. It scares us, and it's scary for families because they can't understand it's an infection, treat it, So that's a big concern right now. We've seen this resistant bacteria emerge right across the country. We've been conducting surveillance in multiple parts of the country, and we're seeing resistant bacteria emerge right across the country. We see it a lot in children, in newborn children, newborn units as well. We see a lot of these outbreaks of very drug-resistant bacteria, and we see a lot of death accompanying that as well. So that is a big concern for us right now, and we really have to think as a country, how do we preserve the antibiotics that we have so that they help us. If I get sick, I want to know that I can be treated if I have a bacterial infection. Sure. So that's one thing. Vitamin C has some relevance or utility in, sort of our mucosal immunity. So a lot of infections enter through what we call our mucosa. Mucosa is the lining of the nose, the mouth, the throat, the urinary tract, the reproductive tract, So keeping that mucosal lining healthy is important in reducing infections entering through the mucosal tract. Okay. But also ensuring that our immune cells are, adequate and able to fight. So, some of these foods that we eat are important in that. So having sufficient vitamins. And this doesn't mean that you go out popping vitamin C. Yeah. What is in your food is probably sufficient. Okay. So that's why we're talking about having fruits, eat vegetables. Just a healthy diet is important in helping you maintain your immunity.
And just taking a bit with when you have a diagnosis of a strain that cannot be cured, cannot be treated, in terms of practice, is a patient led to know this?
We usually will tell the patient that, yes, there is this infection and this is a concern that we have. These are the antibiotics that can treat you, or we don't have antibiotics, but we're going to try this. I can imagine you'd be very scared if I told you that as a patient, that I can't treat you. But we try as often as possible to discuss every treatment with the patient and say, this is what we're treating. This is what usually if someone comes with an infection, we'd take in the hospital, we call it a sample. So we take some blood or urine or whatever sample is available, take it to the lab. And the lab processes it and tells us this is a bacteria that's growing and these are the antibiotics that can work for this bacteria. So then we know the best antibiotic to give you, so that it's not guesswork anymore, particularly where there's a lot of resistance. So usually we discuss, this is what we've done, this is what it has grown, these are the antibiotics that will work. And there are times when we've had to talk to a patient and a family and say, there's nothing in country that can work for you. Maybe there's something somewhere else in the world, if you could afford to bring it in, it would work. But you can imagine that may only work for 0.0001% of our population. So those are very hard conversations to have. And they're very difficult times for us when you have to deal with something like that. And unfortunately, it's becoming increasingly common.
Wow. Okay.
There's a growing concern I've seen in other countries that the more you create a concrete jungle in terms of infrastructure development, it has a direct correlation with the level of infections. Like you see some places in India, the place is all smoky. sometimes some places in China and other countries as well. So because development must happen, but development should be for humans, so it has to be balanced. In terms us as a country, and borrowing from those best practices in terms of disease control and zoned development, what would be your take on the angle we ought to assume in terms of trying to marry both development and disease control?
Okay, so that's a very interesting question, and I think it really reflects why everything we do should be involve multi-sectoral players, because everything we do impacts on something else. The best place to be is where you have fresh air, where you have space to exercise, where you have space to sit with people and socialize. That's the best place to be for your health, for your mental well-being and all the rest. So even as we're thinking about development, one we want to think about, do we still have fresh air? So how polluted is that environment? Because some of these areas without adequate ventilation will affect our respiratory health, will affect your lung health. So we have to think about that as well, so that there's adequate ventilation, there's adequate space, there's adequate fresh air. But also with a lot of crowding, there's issues around management of sewage, for example, management, disposal of waste. And where you have dirty environments, then you have increased levels of infection. So even as development happens, we have to think about waste disposal, sewage management, water sources, the risk of water contamination, where there's a lot of, sewage lines running along water lines, and where you don't have safe water sources, that will increase the risk of outbreaks and infections. So those are things that we must really think about as a society, even as we continue to develop.
Okay, let's take some questions, because there are quite some that are coming from folks today asking already in terms of infections, and we see the regularity of it. Inside one of those is H. pylori. Everybody seems to have H. pylori. It's almost like the friendly monkey on your back. How's your H. pylori today? Fine, thanks. How's yours? Where is this all coming from, and why is it so rampant?
So I think yes, we have seen that, and it's been a concern for us. One of the reasons it's a concern is truly if someone has H. pylori, they require antibiotics for a long time. So usually you'll be put on antibiotics for at least 2 weeks. That's a very long time to be on antibiotics. And of course, as we mentioned, use of antibiotics, particularly for a long time, runs the risk of selecting for this resistance you're talking about. There's been something about how we diagnose it and the tests that are being done, so that everybody who goes into a hospital, there's some what they call rapid tests that are being done, that every test is positive for H. pylori. And unfortunately, we've seen those situations where it's positive 3 times in a row. And I think as a health fraternity, we have to rethink how this diagnosis is being made, because my thinking is that there's over-diagnosis of H. pylori.
Okay.
So with that, there's a lot of antibiotic use as well. And I think for us, it's around going back and saying, what guidance should we put in place? Because truly, there's a lot of over-diagnosis of H. pylori.
Is over-diagnosis same as misdiagnosis?
Over-diagnosis is diagnosing something when it's not necessarily there, or even diagnosing and treating something that you'd have lived with as a friend for a long time without necessarily impacting you. So exposing people to over-treatment. Could also be misdiagnosis. Misdiagnosis may be you diagnose the wrong thing, or you diagnose something that's not there. So you expose someone to treatment that they do not require.
Well, recently there's been some good development. It's not all that bad.
Not all doom
because we're
and
used
gloom.
to Ebola, swine flu, and all that. We had an attack from the HIV and the TBs for quite a number of decades. But now there seems to be a better approach on the viral load management. Sometimes we even hear some countries like South Africa that the viral load for HIV can go to as low as undetectable. And when one is in that space of undetectable, is there prevalence for infecting others?
Okay, I get what you're asking. And we do manage a lot of HIV and do a lot of research in HIV in country. And most people, even in the country, I think there's maybe an odd 1.4 or thereabout people who are taking HIV treatment in Kenya, 1.4 million people taking HIV treatment. About 95% of this have an undetectable viral load, meaning the drug is working and it's suppressing the virus as long as they continue taking it. If they stop taking the virus, the drug, the virus multiplies and goes up. So most people are doing very well on antiretroviral therapy or the HIV medication. Once someone is undetectable, then there's a common slogan that says undetectable equals untransmissible. It means that the risk of passing on the virus to someone else, if the virus in your body is so low that our lab test says undetectable, it doesn't mean it's not there. It's just that the levels are so low we don't detect it using the test that we use. When we get to that point, then there's almost a zero chance of transmitting it to someone else. So if we can get everybody to be undetectable, then we'll really stop the transmission of HIV. The concern we have, though, is there's still a percentage of people who do not get undetectable, or they do that, up and down because of how medication is taken. So if you're not, the HIV medication must be taken daily. It's a daily tablet. So if you're not taking that tablet daily, then the virus is also thinking, I could switch and survive. I could live here, So with that, you end up developing some resistance. And when there's resistance, then you can't control the virus. Or if someone is not taking the drug and the virus has not yet become resistant, you just don't have enough drug in the body to suppress it, then those situations, the virus can be transmitted. Or if, the other important one is, many people do not do the HIV test. So they don't know whether they are positive or negative. I like to ask people, when did you last do a test? So I won't ask you. But, people don't do the test. So if you don't do the test and you don't know, then you could transmit it to others because you didn't know you had it anyway. So I think it's important that we take charge of our health, get to know the HIV status. If positive, there's excellent treatment available and it controls the virus. And I've had patients who have been on treatment for 30 years or more, and they're doing very well.
Wow. Okay. Are ulcers infections?
So ulcers in terms of in the stomach, the upper intestine. So some of those can be caused by this infection called H. pylori, this bacteria called H. pylori. So yes, but ulcers can also be caused by excess acidity because of different reasons.
Low bacteria, perhaps?
Sorry?
Does the low bacteria contribute to low acidity?
So,
the gut you spoke about gut health.
Yeah, so gut health, no, it won't contribute to acidity. So H. pylori specifically, it actually lies in the lining of the stomach, and it can lead to ulcers within the stomach and the upper part of the intestine that's connected to the stomach. So that's one. But people can have ulcers because of the lining of the stomach can be eroded by things like alcohol, can be eroded by things like some of the very common pain medications that we take, Brufen, diclofenac. Those are things that can erode the lining of the stomach. So if someone is popping those every other day for pain, then it's time to see a doctor because you run the risk of eroding that lining of the gut because of these drugs that we commonly take.
Well, a lot of diseases, they revolve around the immunodeficiency. And a lot of myths I like to demystify, because especially when it comes to matters of health, the more we know for a fact, the more we feel empowered, and the more we can start living and eating healthy. So one would ask, is cancer, especially the tumors that are cancerous, are they caused by a specific or a certain pathogen? Because you mentioned the bacteria, the virus, the algae.
So there are some cancers that may have an infectious cause. One of those that's common in women, and for which there's a vaccine available that's given to young girls before any start of sexual activity, is cervical cancer. So cervical cancer is associated with a virus we call the human papilloma virus, or HPV. And it's a devastating cancer, and it's very common in women in this part of the world. So that's a type of infection that may be associated with cancer. We have certain things that we call lymphomas that can also, it's sort of a cancer of the immune system, or that can also be associated with infections. But I think a very important one is cervical cancer of the cervix. And I think it's important for two reasons. One, now there's a vaccine available in country for young girls. In other countries, they also give it to young boys as well, because in boys, it reduces transmission to girls, but boys can also get penile cancer if they get this human papillomavirus infection, certain types of this human papillomavirus. So I think for us, it's for those who have young girls, teenagers, take them for the vaccination. For women, for older people who are not at the place of getting vaccination, there's screening for early detection, so that if detected early, it's totally treatable. But if not detected early, it's a very devastating cancer.
Okay. What would you then say in terms of going out and getting a test? For whatever the case may be, to then reduce the levels of self-diagnosis and self-prescriptions that we are doing on whatever end. Because if you go to a pharmacy today and you don't have a prescription, chances are that if you wanted it badly enough, you could get the thing. We know that. Whereas in other jurisdictions, it doesn't matter what you do, bring your uncle and his cow. They're not going to give you medicine.
You have to bring the cow.
Yeah. They're not going to give you medicine without a prescription from a qualified health practitioner. So how then in this ecosystem which we operate, because we can say this, but then there are folks who will sell no matter what.
That's true.
If I go and I'm desperate enough because either I don't have enough money to go do doctor's consultation, but I'm feeling a certain type of way, I can go into the chemist and somebody will give me something. How do we start to have that conversation around all of these elements working in tandem?
That's such an important question, because again, this is one of those battles that not one person can win it alone. So there's actually a law against selling an antibiotic without a prescription.
In Kenya?
In Kenya.
Oh, wow.
Yes. There's actually a law against it. The only problem is enforcement. So I think this is one of those areas where the Ministry of Health, the Poisons and Pharmacies Board needs to up their game, because there needs to be that restriction. Because in those countries where they will not sell it to you, it's not because they don't want to sell it. They don't want to make the profit. It's because somebody's watching and there are consequences to doing it. So I think for one here, we're Kenyans. People won't just do the right thing because they want to do the right thing. Everybody wants to take a shortcut, perhaps. So I think regulation is the way to do it. PPB, Ministry of Health, has to figure out how to ensure that pharmacies are not selling without a prescription and regulate that strictly. And that's been done even in African countries. In South Africa, for example, you will not buy an antibiotic over the counter because the regulation is very strict. So I think that's probably the biggest thing that should be done. The other one is about now this awareness. If I know that this antibiotic I'm taking is going to be harmful to me, the chance of me running off to take an antibiotic is a little lower.
Right.
But if I don't know and my neighbor felt better, why shouldn't I also take it?
Yes.
So I think what you're doing here in terms of even talking about it is really, really critical. And the more we can talk about it so that people know, it's very important. Patients come to my clinic and I bought myself this, I was given this. And when I tell them don't take, they're a little confused. But when we explain why, they're like, I didn't know that. I won't take it anymore. So I think this awareness is critical in getting people to understand why it is harmful.
Further, let's demystify. Patients come to you and they have you develop, you have your diagnosis, the differential gives you this diagnosis you have. And then a prescription comes up. And patients are told, when you send them to the pharmacy and they're there to collect their meds, they're asked, you want generic or you want original, which mostly comes out as a scam. Coming from definition of general Kenyans. But from your point of view, what is that variation between now what you call generic and this other stuff?
Okay. So usually when drugs are developed, the innovator of the drug, the one who comes up after many years of lab processes with, this chemical actually works. So that's the innovator.
Because the COVID vaccine took a few days, but okay, after many years. Yes.
I know. COVID vaccine took a few days because there had been many years of coronavirus research. So it wasn't out of the blue.
Okay.
It was adapting what had been done for coronavirus quickly.
Okay.
And maybe a lot of funds were poured into it. A lot of research is stunted because of funding. Politics for another day.
A long conversation.
So the innovator company, the one that manufactures that original product, they hold something called a patent. A patent is like your copyright. I don't know what would be easy, I write a song and it's mine. You can just go selling
rights
it,
of
right?
ownership.
Yes, rights of ownership. So usually that initial product is quite expensive because sometimes it takes years to manufacture a product and they want to recoup everything they've put into this process. But after the initial sales, and unfortunately, it's never really available to us in this part of the world because of just market issues and whether they can recover their costs. But usually, companies will then release this patent to what we call a generic manufacturer. So this other manufacturer doesn't have to do the work of developing the drug. All the formula is given to them and all they have to do is manufacture it. They've not developed it. So it means they can roll out at a cheaper cost than the original product. So that's why you have the original product usually is quite expensive. Then what comes from these generic manufacturers, many of whom are in India, are cheaper because they've not put in all the background work into discovering this product. So often they are comparable in terms of their activity, because it's still the same formula that has gone into producing them. But it's just that it's a different manufacturer, cheaper. So that's where the generics come from. The concern sometimes is that if you do not do quality assessment of the products that come in, then you may end up with counterfeits. You may end up with someone taking shortcuts to make bigger profits. And that's a role that the Pharmacy and Poisons Board is tasked with. They need to carry out quality assessment of every product that comes into country, and not just at the time it comes in, but over time. Because when you tell a company, I'm going to do quality assessment, they'll send you the best batch, but you have to keep vigilant and keep testing other batches over time. So usually the generics are cheaper and they're okay, they work well. I'll give you an example. For example, we're talking about HIV treatment. Most of the drugs we use in country are the generic products that come from India, but they work very well because they're really based on the science that developed that drug.
Wow.
There's a lot to learn, and like you said, there are many of these things we touch on that could be conversations for hours, but that these are also conversation starters that we can have in our different pockets, and also here on these platforms in a good way to then be able to end the week, but also give us food for thought, literally moving forward. Dr. Loice Ombajo has been here with us this morning, an infectious disease specialist. Thank you very much for doing this with us on a Healthy Friday conversation. Very important, and my mind is already whirling many things. Asante sana.
Thank you.
Joe, well done this week. Thank you for hanging out and keeping conversations moving.
Thank you. And we forgot to mention something. Yesterday we had SONA, today we had SOJA, State of the Judiciary.
Yeah, that's true. That was something that was going on today as well. So, let's see what happens with that as well.
And a safe and healthy weekend to everybody.
Thank you.
Right.
Eat well, sleep
healthy.
well, exercise, wash your hands.
Avoid buying
antibiotics.
And if people want to find you, Dr. Ezwi Penoff, where do they find you?
So I teach at the University of Nairobi. I see patients at the Kenyatta National Hospital. So if you come to the University of Nairobi and ask for me, you will find me.
Right.
They can email me. They can reach out to, I don't know what you do if someone wants to find you. Do they reach out to someone to get an email address?
Well,
how do you do it?
Tell them where to find you.
Okay. So, yes, you can email me, loice@uonbi.ac.ke.
Fantastic. Thank you so much.
All right, thank you.
Thanks, everybody. This has been The Situation Room this week, getting into the weekend. Have a good one.
This is The Situation Room, the only way to start your day.